When we are born, our genetic code has the blueprint for every part of our body. This includes the shape and size of our teeth. During orthodontic treatment, we unravel and align the teeth, and in order for everything to fit properly and bite properly, the size and shape of your teeth will make a big difference. Through years of research, we've learned that for a perfect bite, the upper teeth need to be bigger and wider than the lower teeth by a certain amount. And if your genetic code does not have the proper size ratio between the upper teeth and lower teeth, the bite will not fit properly. Upper teeth are supposed to be outside, around, and draped over the lower teeth in every dimension. Let's think of a target. The outside circle is bigger and requires more paint to draw than the inside circle. In this example, the upper teeth are the outer circle and the lower teeth are the inside circle. You need more paint or tooth mass in the upper teeth and less paint or tooth mass in the lower teeth for the target to be drawn correctly. Usually, the teeth will fit fine, but sometimes the genetic code does not deliver perfectly shaped and sized teeth. If this is the case, there are a few ways this will show up. The first most likely case is when the upper incisors are too skinny or the lower incisors are too wide. If this happens, we must make the upper teeth bigger or the lower teeth smaller for everything to fit properly. The next most likely situation is if your upper premolars are too skinny or lower premolars are too wide. In this case, we need to make the upper teeth bigger or the lower teeth smaller for everything to fit properly. The only way to make teeth bigger is by seeing a dentist to place crowns or veneers or fillings on them. This has an added cost and usually means we need to cut down healthy teeth to place extra tooth mass onto your natural teeth. If the difference in ideal size is less than a few millimeters, your orthodontist can perform a procedure called IPR, which helps correct the problem without the added cost. IPR stands for interproximal reduction. In simple terms, we polish small amounts of enamel off of selective areas in between certain teeth to shape them so that everything fits better. The process is painless and very quick. When done properly and conservatively, there will be no long-term side effects to this treatment tool. Only small amounts of enamel is removed, leaving an adequate amount of protective enamel on all aspects of the teeth that are polished. IPR is a tool that has been used for decades in orthodontics. It is safe, effective, and is definitely the most cost-effective way of solving tooth size issues. Once this is done, your orthodontist can use other tools to move the teeth into the proper position so the bite fits properly. In extreme cases, IPR is not possible. So, if you do not want to cut down healthy teeth to place veneers or crowns or fillings to make the teeth bigger, what are your options? Think back to the example of the target. If the upper teeth are too skinny or the lower teeth are too wide, then there is not enough paint or tooth mass in the upper arch to go completely around the lower teeth. If the difference is too big, we must try to correct the bite and leave spaces where the extra paint or tooth mass is needed. Your orthodontist will try to hide these spaces in areas that are not visible. When there are tooth size issues, we must select one of these options. The only alternative to these options is to accept a less than ideal result, which is a result that is unstable and can cause damage and trauma to your teeth in the long run. To know which option is best for you, speak with your orthodontist. Thanks for watching and good luck.